What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason, probably not going to change. Fan question, talking about nursing residency programs. Quite honestly, I have just a minimal amount of experience and knowledge when it comes to residency programs. For those of you who don't know, residency programs exist in the world of nursing, I think in two forms. They have, well, okay, take that back, I think three. They have a residency program for current students, like a summer residency program. If you're in the baccalaureate program, you fall and spring semester, you go to class, and then in the summer, most programs have the summer off, and there are facilities that offer summer residency programs. They sometimes interchangeably will call them internships. And they're internships if you're still a current student. Residency, internship, current student. It's a experience to gain clinical skills, to gain experience. You act as a nurse's aide. You work closely with the nursing staff, and I think it's facility specific. You get to do its responsibilities above and beyond the allowed actions of a nurse's aide. So I think you would be able to actually give some medications. I'm not sure if you'd be able to give like sub-Q injections. I think it really has to do facility specific, but you still have to act within the guidelines and the scope of practice of what a student is allowed to do with a certain amount of supervision. You have those residency programs, internships. And then you have what are called externships, or they're also called residency programs. And those are for the new grad who's transitioning from student to bedside nurse. They may or may not possess their RN license yet. Residency programs actually exist for nurse practitioners as well. Once again, you just graduated from school, and you're either taking your boards, just took your boards, just got your license, and you're looking for that first job, so you're making the transition from being a student to being a practitioner, being a student to being the provider and or nurse. The point of these residency programs is to make an easy and sound transition from classroom to practice, from what they teach you to what you do. We all know there's that gap between what they teach you in nursing school and what you actually do in the nursing world. There's a huge gap there. And that gap is slowly closing, but there's still a lot of holes. It's kind of Swiss cheese-like on certain aspects of nursing that are not covered in nursing school, that the nursing school programs expect you to learn once you get out there, pass your boards, and are on orientation. These residency programs fulfill and fill in that gap. A lot of them are 3 months, 6 months, 9 months. I've even heard of residency programs that are year-long. And I think the year-long one I heard was as a nurse practitioner, a new nurse practitioner. Are they beneficial? Absolutely. But the question is it something that you can do? Is it something your life can afford? Is it something that you're able to do? Because a lot of these residency programs are not local. You have to travel. You have to go to a different facility. And some of these residency programs are paid. Some of these residency programs are not. Yes, I know, they're not paid. That's kind of a difficult decision there. Because ultimately, most students can't wait to graduate and start making the money. And then some of these residency programs, I know the pay rate is not what you would make if you were working as a standard nurse practitioner. I think they're good for individuals that are looking to gain additional experience that they felt they didn't get enough in their previous program. If the stars align and the money is there, the location is there, and the opportunity is there, I would absolutely do it. Some of these residency programs provide like certifications. Some residency programs are specialty focused. You go to like a trauma residency program, a surgical residency program. Now, obviously that's for nurse practitioners as opposed to RNs. Do I think they're worthwhile and worth looking into? Absolutely. Do I think that it's something that should be mandatory? I think eventually it should be. There's a lot of talk about standardization of education and training of nurses and or advanced practice nurses. Right now, we still piecemeal together our education and training, and it's very diverse and not standardized. More and more facilities and managers and providers are figuring out that they want to fill in these gaps. They want to give new nurses the best chance possible to succeed. They're finding out that a lot of nurses, when they graduate and get into that first job, it's very overwhelming and they feel very underprepared. Burnout or failure rates are going up, as well as nurses who last a year or two and then get out of the profession altogether. They feel very overwhelmed and realize that what they learned in nursing school is not what goes on the hospital floors. I think residency programs are a great start. I think it's going to evolve over time, and I'll be interested to see how it goes. What do you have to say? What do you think of residency programs? Who out there has actually gone through a residency program? Can you offer some insight? Would love to hear your thoughts. Always like to see a comment down below. Comments are my caffeine. Share this with somebody. And as always, check your own pulse first.